Welcome to New York Institute of Technology's podcast, The Scope. Produced by the College of Osteopathic Medicine, our episodes focus on the medical school experience and how it helps shape future physicians. Learn about exciting new health and wellness initiatives, cutting-edge medical research and technology, and how to effectively navigate medical school. We are excited to have you join us.
Good morning and welcome to the Scope podcast. I'm Alessandro Mercado, second-year med student at NYTCOM, SGA First Vice President, and your host for today's exciting podcast conversation. Today we're joined by an amazing professor, osteopathic physician, and academic leader. Please welcome special guest, Dr. Sheldon Yao, Professor and Chair, Department of Osteopathic Manipulative Medicine at NYTCOM. Today our conversation will focus on OMM, overall perspectives, its growing demand and acceptance in medicine today, as well as related career opportunities for medical students. Thanks, Dr. Yao, for joining us.
Thank you for having me.
I have to say, as an osteopathic medical student, I'm really looking forward to this conversation. So let's jump right into our first question. Dr. Yao, how has the overall perspective of osteopathic medicine and being a DO changed since you have been in practice?
Well, I feel that overall, the numbers of DOs in practice have grown tremendously. We've had increased numbers in osteopathic medical schools. And so 1 in every 4 medical students now graduating is a DO. I think the volume of DOs that have been in the medical field has increased our exposure. I felt that as a student, there was a little bit of a stigma 20 years ago when I was going through medical school that osteopathic schools were inferior to allopathic schools. But I think that there's definitely been a shift in numbers. I think there's been a shift in perception as we're graduating and putting excellent osteopathic physicians out there. And more students actually that I interview are saying this was their first choice. They wanted to become an osteopathic physician. They wanted to be a DO because they had osteopathic mentors. They had doctors out there that were DOs that they interacted with, and that inspired them to come to osteopathic school because the osteopathic philosophy approach resonated better with what they're trying to do as a future physician.
Beautiful, yeah, thank you. And I'm really excited, and that makes me even happier to be here at NYTCOM. So, as a follow-up, what makes DO students distinct and stronger candidates for certain residencies?
Well, I think that osteopathic medical students have the opportunity to really learn how to interact with our patients and look at our patients with a different lens or perspective. And most of that focuses on the tenets of osteopathic medicine, which stresses the person as a whole, structure and function is being interrelated, and that our bodies have the inherent ability to heal and improve. So I think that we focus strongly on that musculoskeletal component of the body and how that interplays and ties into patients getting better. And it goes hand in hand with different specialties that involve palpation, that involve musculoskeletal diagnostic skills, particularly family medicine, physical medicine, and rehabilitation. It really could be integrated to any field. Osteopathic medicine isn't only just hands-on in the techniques, but it really is a perspective that we are looking and interacting with the patients with a different viewpoint of how does their musculoskeletal system interact with all aspects of their healing.
Great, thank you so much. And I definitely feel, even just as a second year, that I'm getting skills that are going to help me so much as a future physician with OMM. So while we're on the topic of residencies, can you explain what an OMM residency is and why would a candidate want to do an OMM residency?
Sure. So residencies are available for specialty training in osteopathic manipulative medicine. They call it neuromusculoskeletal medicine. So you might see osteopathic neuromusculoskeletal medicine, or OMM, as a residency category choice. And I think that there's been many different iterations and names of it, and so it might be confusing, but that is the official name now since the single accreditation. So this is a ACGME accredited residency, and anybody who completes medical school training can apply. This includes MDs and DO applicants. The DO applicants, of course, are preferred because they have the additional 200 hours plus of training in undergrad and being taught the philosophy years 1 through 4. But I have met MD candidates that have taken the time to apply for these and study and learn osteopathic principles ahead of time. So OMM is a specialty that is focused on training physicians to become specialists in osteopathic medicine. And this includes utilizing OMM in all different patient populations, including hospitalized patients, including outpatient treatments, including babies, kids, adults, geriatrics, sports medicine. It spans the gamut. So as a OMM trainee, you're going to learn how to apply OMM in acute care settings, in the ICU, all the way up, from babies all the way up to geriatrics. And so I had the opportunity as a resident to do a family medicine residency first, and then I did a additional 1-year +1 program. But that's what it was called back then when it was still under just AOA accredited residencies. But the opportunity for people to complete a OMM residency could be right from graduation, and you complete it after a internship year, and then it's additional 2 years, or you could finish whatever specialty you have interest in, whether it be family medicine. I had a colleague that was internal medicine. Currently at St. Barnabas Hospital, we have a resident who finished peds first, and they wanted to really get board certified and trained in hands-on medicine in OMM. And that's why they decided to do that extra year. And they call that a OMM 3-year, because it's that 3rd year that they complete to become board eligible to take and sit for the exams for board certification in OMM.
Okay, great. Yeah, I really love to hear that doing OMM training gives you such a diverse skill set to treat basically any population of patients that you want to treat as a future doctor. While we're still talking about OMM residency and training, can you talk about some of the misconceptions people have about it?
Well, I think that people don't understand what a OMM specialist can handle and do. I think that they don't consider it as a potential residency option because they think that people who do OMM only become academic teachers in the schools only. There are diverse opportunities for OMM graduates. Yes, we have a lot of medical schools opening up, and there's a tremendous need for faculty and academics. And if that's something you love and wish to pursue, that's great, because I think most students, their first exposure to someone who is OMM specialized is at the medical school level. But there are doctors out there who are OMM trained, who are running OMM departments at hospitals, treating hospitalized patients. They are involved in private practice. So there definitely is a need for physicians practicing OMM in private practice. There's people who specialize in OMM and then really focus on research. And so there's a lot of different opportunities out there for OMM. It's not only teaching at the medical schools, but also being able to go out there and do private practice, to work with different residencies. In fact, a lot of the different offices out there are reaching out to me and saying, hey, do you have any recent OMM board certified graduates? Because I'm looking for someone to hire to join my orthopedic practice or my PM&R practice, because they want the patients to have a non-surgical option first. They want them to try something first. Like, I hurt my shoulder, I went to orthopedic, I had to have surgery because I tore the muscle, but at their office, they had an option for yoga, they had an option for PT. And so some offices are now trying to hire somebody so that they have an option for OMM also.
Gotcha. Thank you. I'd love to hear that the opportunities are almost endless with what you can do post-board certification. So finally, a good wrap-up question would be, how does osteopathic medicine continue to grow and expand?
I think that there was a lot of trepidation when there was a single accreditation. But what I'm seeing is that as long as there is efficacy, and this is something I see every day with applying OMM on patients, and patients are telling me, you're the first doctor that was able to hear me out, look at my body and treat something, and it's the first time I felt confident and able to do something. right? I hear that constantly, and I'm always amazed at the potential effects of this. It's something that I think will continue to grow as long as there is interest from patients, right? And that there's proven efficacy. And so I think that as a profession, we're going to continue to grow because we have graduating students. I think that those interested or that have a particular interest in OMM should continue to pursue that and consider the options of specializing in it if that's their passion. But even if you don't specialize in OMM, you already as a DO, having that DO at the end of your name makes you an osteopathic physician. And there are so many DOs out there that are integrating osteopathic philosophy, principles in their approach, which really makes a difference. Like I have patients come to me and say, listen, I only want to see DO doctors. Like there's a difference to their approach, to their treatment, to how caring or empathetic or how they speak to you. And I'm proud of that. And I think that our profession will continue to strive and grow. The principles, the practice of osteopathic medicine really focuses on the health of the patient. We want the patient to be healthy. We want the patient to focus on wellness. We're looking at the body to make sure that it's optimized and that they could reach their maximum capacity for healing, which is very different from disease care. It really is health care. I do see that the future for our profession is bright. I think that I see it in our students, their interest in the subject, in learning this and really applying it for their patients is growing.
Thank you so much, Dr. Yao, for all of your insights. I really appreciate all of the knowledge and experience, and especially the leadership that you have on our campus. Hearing what you've had to say about OMM residencies, as well as the career opportunities, and sort of getting through all these different misconceptions that people may have has only reinforced my passion for wanting to come to NYTCOM in the first place, and just why I want to be a DO physician in the future to help the well-being overall for my future patients. My experience as a second-year med student now is still very limited, and I have so much more to learn for OMM, but day in and day out, I'm using it in my life just to help with learn more about my patients and my fellow students, and I feel like it's going to help me become the best physician I can possibly be alongside all of my peers, so that us, the next generation of healthcare physicians, can do all that we can for the well-being of our future patients. So, Dr. Yao, thanks so much for joining us today. This has been a great conversation covering some really valuable information. We truly appreciate your sharing perspectives and expertise on OMM today. This info can definitely benefit medical students as they make career choices for residency and beyond. It also helps all of our listeners better understand the overall importance, demand, and positive outcomes of using OMM in medicine today. I also want to thank our listeners for joining. I hope everyone has an amazing day.